In this video today, we're going to talk about telemedicine and what is the nitty-gritty details, how to understand it as a patient, how it can benefit you, and why it's easier than you think. Stay tuned.
Cutting Edge Pain Relief, the channel that teaches you how to biohack your pain and get back to doing what you love.
So, a few things in that context. The first thing that you need to be able to kind of think about is, so why would you even want to do it? Let's say that it is easy. You know what? I just much rather go see my doctor and I don't have to kind of deal with all these different barriers that prevent me from being able to interact. Well, there's a number of reasons why you might want to consider the use of telemedicine. So right now, clearly we're in a very tumultuous time. There is a pandemic, viral exposure that puts everybody at risk. So being able to be quarantined and not have exposure to the virus is useful at this point in time. But there are other reasons why telemedicine may have value to you once we're past all these challenges and trials. First is that it's more convenient. So instead of you having to get in a car or catch some means of transportation like a bus or another pickup service in order to get to the doc's office, you don't have to do all that. You can wait in your living room or your kitchen and someplace where you're comfortable. Number two, you don't have to wait in a waiting room because invariably you get to the doc's office and we don't see you right away. We know that you're going to have to wait for a little bit. You're going to have to wait for 15 minutes, 20 minutes, 30 minutes, and many times a few hours. So would you rather wait in a waiting room with traditional sticky magazines that are 30 years old from National Geographic, or would you rather be able to wait in your own home? Additionally, if you have to get in your own car, you have to spend the gas, you have to do the travel time, you got to get all those type of things in order to get into the destination and location, and sometimes you have to find the office. Also, most of the time, you're still going to your doc because they're close to you in geography. Think about if you could have a doctor that you really connect with, that can really give you the treatment that you need, but you're not limited based on geography. You live in South Bend, Indiana, and you have a doctor that you know is phenomenal, that got you, that understood you, knew what your problems were, and they're in Boston, Massachusetts. You could be able to connect to that doctor, at least in the current state, and probably in the future, a good number of the limitations that we've had with state to state lines, those things may be changing. So historically for telemedicine, physicians could only practice in the state where they had licenses. So traditionally, those patients were limited to seeing physicians that were close to them in proximity. But that may change in the future, where you can have a doctor who's your primary care doctor or a subspecialist that's not limited by geography and location. Also, it's your time and convenience. Let's say that you're working and you're working consistently, whether you're in home or whether you're out of home. You don't have to take time away from your job, at least not considerable amount of time, in order to go to a doc's office. Many of my patients, if they're going to come visit me in office, they would have to say, well, you know what, I got to take a half day because I got to get away from work, I got to drive, I got to come here, I got to wait in the waiting room, have the meeting with you, then after that, then I got to drive back. None of that's going to happen in 20 to 30 minutes. We have patients right now that have telemedicine visits and they take a break while they're at work for about 20 minutes, go back to work, no excess time wasted. Another potential value to patients. And then finally, for the healthcare system as a whole, is it's more cost effective, or it can be more cost effective in terms of being able to have savings, both from a provider standpoint as well as from a patient standpoint. So frequently technology is considered as a potential challenge to being able to do this, whether it's computers or whether it's phones or whether it's tablets. Many people just feel like they're not facile with being able to use these type of items. And the fact of the matter is, you don't need to be a computer whiz. You don't need to be super fancy in terms of being able to utilize this. If you can flick on a button to a computer or to a phone, you very well can be talked through how to be able to communicate and how to get information across. Look at telemedicine and the value that it can definitely bring to both patients, healthcare systems and providers, we know that it's not a perfect solution, but we do know that it can be able to help fill a gap, help people, keep them safe, provide care, and be able to give them a better experience at times than what we could from just a brick and mortar healthcare experience alone. So, as we try to find ways to be able to make this easier for everyone involved, consider that there are benefits and it's not going to be as difficult as what you might think. If this video provided value to you, please hit the subscribe button for more videos on how to be able to biohack your pain and be able to live a more fuller life. Please stay tuned to our channel and continue to follow us. Take care and have a great day.